All right, so I have Tristan on the table here, and I'm going to demonstrate quickly what you can expect at the flu clinic this year. Many of you have been to the flu clinic before, and you have done NAET with me, and so you're familiar with this process, but it'll be a good quick review. And other people, you may be brand new to this process, and this is just a natural way to rebalance your body and show it how to be strong and keep optimal communication open so that the body can fight colds and flus as they might come your way this season. So we start out by balancing the body, and we do a roll call basically to assess what organs and meridians and systems in the body may be showing up strong right now or weak. And so we're going to check Tristan out real quick, and we're going to balance him out with that. Can I borrow your arm?
Mm-hmm. Yes, Mom.
And can you hold your arm right like that?
Mm-hmm.
Great. And can you resist?
Yes.
Nice. And hold and hold. Great. And so we start at the brain and hold. And lungs. He's got a little weakness in his lungs, so we create friction right over the lung points. And we recheck and hold. Nice. And both lungs are strong now. And his kidneys are a little weak, so we do a little bit of friction right over the kidneys. And now hold. And the other kidney was also a little bit deficient, a little bit weak coming in today. So we just strengthen that in the moment. Great. And can you hold? Good. Good. All right. Can you put that arm down for a quick second? So we're going to use a little energetic vial. It's about this big. And it's been programmed and imprinted with the energy of the cold and flu virus for the season. And you're going to put that right in your hand.
Okay, Mom.
So Tristan's being very, very helpful right now. So once again, now I get to check all the organs. And now that the flu virus has been introduced into his system, not as an actual chemical form, but more on an energetic form, we get to practice and check and see what systems suddenly might be weak to the flu and the cold for the season, and we get to strengthen it with some nervous system stimulation. So once again, we're going to go and check all these organs that we made sure were strong at the beginning, and hold. And his lungs go weak, and his pancreas, and his kidneys, his bladder, his kidney, and his small intestine. So it gives me a little checklist to know I need to make sure that those organs are strong and in fighting order and can communicate around the cold and the flu virus this season when it comes his way. So I'm going to get you to flip over onto your tummy while we teach your body something.
Okay, Mom.
All right.
Do you want to step
You keep holding, you know the drill. Can you turn your head to the side? There you go. Can you breathe in like a big boy for me?
Yeah.
Good. And breathe out. And pant like you're hyperventilating, like you're running up a hill. There you go. And then normal. And normal. So we're using a spinal stimulator. I don't know if you can see the angle. There it is. And that creates vibration over the nerve points of the whole spine and spinal cord, which relays information up to the brain, wakes up all parts of the body and nervous system to pay attention to anything that's in your environment right now, which for him is this cold and flu vial. Go and flip back over. So now we get to test and see. Hand up. Bring that arm down a little bit. Great. And can you resist?
Uh-huh.
And his lungs are now strong when they weren't before. His pancreas is great. His kidneys are great. His bladder's good. His other, roll that arm, hold. There you go. His other kidney, good. And so we've got strength, small intestine, go and hold. So we've gone through the checklist, and his body is now testing very strong and communicative around this little vial that's in his hand. So the second part of the session when you see me is we stimulate acupuncture points with vibration and or gentle self-massage. So keep holding that for me. And we start off right on the thumb web space, and we're just going to do vibration right there on the right thumb web space. And then right on the outside elbow, right where the crease ends on the outside part of the elbow. Then we go to the left side of the body and we do reverse order. So left outer elbow. We do left thumb web space. And we do left inner ankle, 4 finger widths up the inside of the ankle bone. So you find that point, sharp point of the ankle bone, and you measure 4 finger widths up the inside. Then at the left big toe web space, just above the knuckle. And then we do the right big toe web space. We're going to reverse our way back up to the first point we started on. Then 4 fingers inside the ankle bone. And then right back up here at the thumb web space. All right, so when you're massaging these on yourself, it's a very gentle clockwise motion. It may look reverse here because of how I'm videoing it, but it's a clockwise direction as you go up, and then you go across your body. So you can do these manually. You don't need a little stimulator, but the stimulator is just nice to have. It kind of gets deeper. And once again, he would continue holding this, so I'd send him out to the lobby if he was here for the flu clinic, and he'd continue holding this for 20 minutes until his time was up. And then he's done. And then his body is prepared and has seen the flu virus for the season, and we've shown all the organs to be strong and efficient at fighting the flu for this season. How do you feel?
Good, Mom.
All right. You want to say hi to everybody?
Hello.
Thanks. See you at the flu clinic. Hope to see you at the flu clinic in September.